Hi, I'm Dr. William Starsiak with the Starsiak Osteopathic Clinic. In this video, I'm going to be talking to you about buprenorphine usage in pregnant women. The effects of opioid addiction are intense and debilitating. This is especially a concern when women are pregnant because the health risks to fetuses are very high. Now, there are many physicians that feel uncomfortable prescribing buprenorphine during pregnancy, but when we look at the FDA fact sheets for this medication, it actually is a very reasonable step to take. The reason being because of the alternative being terrible. If a woman is engaging with illicit opioid use during pregnancy, the consequences to the fetus are going to go above and beyond the potential risks of monitored buprenorphine therapy. Overall, we could really use some more research to completely map out the terrain of using buprenorphine in pregnancy. But the studies that we have are enough to lead us to believe that it's better to use buprenorphine to manage opioid addiction than to not use it and have someone going through typical drug-seeking behavior. So the general consensus is that when someone is closely monitored by a physician, the usage of buprenorphine to treat opioid addiction during pregnancy is, on balance, the best route. What the evidence shows is that even at very high levels in dominantly rodent models, there's not as much research in humans, but it shows that there's no teratogenic effects. So it doesn't mess with organ development. Really, the one thing that plays out regularly in animal models at levels higher than what we would treat a human with, the one thing is loss of an embryo slightly increases in treatment groups. But this is compared to embryos that aren't exposed to any opioids. So with opioid use in general, there is going to be the same decreased fertility where a conceived embryo does not survive as often as one that is not exposed to opioids. So this is also at play with buprenorphine. The effect is not huge, but there is a small effect. It can also prevent a woman from becoming pregnant as easily, but it's not on the level of contraception. It is a small, fractional effect on fertility. So here at Starsiak Osteopathic Clinic, we are most happy to work with pregnant women who are seeking to get help for opioid addiction, to help them live more balanced lives, both for their own health and the health of their child. We do expect that the child will go through neonatal abstinence syndrome, where the child will have become used to opioids. So once they are born, they will go into withdrawal and they will need to be detoxed from opioids over the period of a few days. When we compare a mother who took methadone to manage her opioid dependency to a mother who took Suboxone, the mothers who took Suboxone have children that don't need to stay in the hospital as long. They don't need to use as much morphine in the detoxification process. So these studies really show that it's a better route than methadone when possible. Now, of course, everybody is individual, and it's not a blanket statement that anyone who comes in here and wants to use buprenorphine during their pregnancy, that's okay. But in most cases, a woman who is opioid dependent, we would be most happy to work with using buprenorphine. So if you have any questions about this, you can contact me, info@drstarsIak.com. You can check out my website if you want a little bit more of information about my clinic, www.drstarsIak.com. You can also give me a call or a text at 317-410-9978. Thank you very much.